Hello everyone and good afternoon. My name is Eskandari and I'm a student of University of Buckingham, and I'm going to talk about my paper entitled of 12 linking CNN decisions with cancer signs for breast lesion classification from ultrasound images. Breast cancer now is the most common form of cancer in women, which is affecting many women every year. And ultrasound images are one of the tools that can really help us to identify this. And in comparison to other image modalities, ultrasound is one of the lowest cost and effective ones. And in fact, BI-RAD has been developed to describe different cancer signs such as shape, margin, calcification, boundary, echogenicity pattern, and so on to help radiologists to report the malignancy stage of a lesion in a standardized manner. For instance, in the top, you can see a malignant lesion with calcification points here, and also a benign one with calcification points here. And indeed, a lesion with calcification is usually seen as a small bright region on ultrasound images, and it has different shape and brightness level. In recent years, several CAD systems have been developed for classification of breast ultrasound images, and they reach a very good performance. However, these models have the limitation of not being able to explain their classification decisions, and in particular, there is a strong need to explain the CNN decisions in medical applications due to the fact that many doctors are really concerned about this black box style decision making. And for instance, consider a model that will tell us it's 100% sure that it captures a malignant lesion. But the main and the most important question is why and how. And to do this, in this paper, we investigate the importance of calcification points as a strong feature of malignancy. And the reason that we choose calcification is that many lesions with calcification might have clinical assessment like biopsy. And we visualize our network with three different visualization techniques. One of them is CRM, and another one is GradCam, and we also adapt another method which we call it entropy GradCam, that we will talk about it in following slides. Now let us talk about our proposed method, and inspired by GradCam, which uses the gradients of the prediction score with the respect to the feature maps in the desired layer. We aim to explore an adaptive way for selecting the feature maps with relatively high information instead of simply aggregating all of them. And therefore, prior to the gradient calculation in GradCam approach, we employed Shannon entropy as a metric to measure the amount of information in each feature maps. In fact, the feature map elements were normalized between 0 and 255, and then entropy of these feature maps will be calculated, and feature maps with entropy higher than 0 or any predefined threshold will be aggregated, and then we use those feature maps to the final visualization heat map. In this paper, we developed two different CNN models with different architectures, and we call them GNet and BNet. And we used dataset A for training our both of our models, which consist of 326 malignant and 798 benign cases. And also, we have another dataset which we use it as an unseen dataset, and in order to investigate the link between calcification of benign and malignant cases. And also here in this table, you can see the performance of our model on both of these data sets. And we are here curious about the why part of our performance, and we want to improve the trustworthiness of our models. As a part of our analysis, we evaluated the interclass differences and intraclass similarity between benign and malignant cases in dataset B. and we generated a heatmap score from Inception 5V layer of GNet with CRM, GradCam, and eGradCam with threshold 0. And we averaged their heatmap score from a single to a single heatmap. And in all these three visualization techniques, we can see the distribution of the highest important area that contributed to the final decision of the network is completely different, and it shows us that our network uses different region parts to make and to classify benign and malignant ones. And also when we compare GradCam and eGradCam method with threshold 0, we can see both of the methods produce the same visualization output, while eGradCam uses an average of 66% of feature maps in benign and 71 feature maps in malignant cases. And similarly, we used GradCam and eGradCam to generate an average heatmap score for correctly classified from last convolution layer of BNet. And as we can see, the distribution of the importance area completely different between malignant and benign cases. And the lesion boundary texture of benign is more contributed to the final decision of BNet, while in malignant cases, the middle texture appears play an important role in the classification decision of the BNet. And also when we compare BNet eGradCam and GradCam method, we can see the same visualization output, while eGradCam uses an average of 60% of feature maps in benign and 47% of feature maps in malignant cases. As we mentioned earlier, there is no evidence that birth classification CNN models use any domain known cancer sign to make their decisions. However, we used our method to estimate the importance of classification in the correctly classified benign and malignant cases. And by extracting heatmap scores on classification points, we find that classifications are more contributed to the correctly classified malignant cases, while it is less contributed to the final decision of the benign one. And we can see the same pattern on the different visualization techniques on both of our models. And also for further analysis, by comparing the classification scores of correctly classified and misclassified of benign and malignant classes, we found that classifications are more important in misclassified benign, and they are less contributed to the final decisions of the network on misclassified malignant cases. And we can see the same pattern in both of our models with different visualization techniques in this slide. And in conclusion, in this paper, we explored different CNN visualization methods on BNet and GNet with reasonable classification performance. And also, we are the first one to find the link between the classification feature as a domain known cancer sign and the CNN classification decisions on breast ultrasound images. And also, we find that classification sign is a strong feature learned by CNN to classify malignant lesions, and it has relatively low contribution to benign ones, which indeed is in line with the medical understanding. And also, by injecting entropy of feature maps, we adopted GradCam, which we call it entropy GradCam, which in fact produce the same results as GradCam, while a smaller number of feature maps from the last convolution layer are contributed to the visualization output. And in the future work, we plan to investigate the domain known other domain known cancer signs such as echogenicity or other cancer signs, and Also, we are going to investigate other cancer types like thyroid. And thank you for your attention.